Hello, guys. I'm here again. Actually, this is very important message. You know why? I'm actually going to react to one of my patients' posts. You know, the findings that we saw on his blood test. This is something that he posted himself. I usually don't discuss about my cases or my actual patient unless they give me a permission. So let's discuss this because this is very typical, and this is a patient who is unvaccinated and didn't got the infection in 2021 and another one in 25, and obviously has some symptom, and so he decided to see me. So that's that. So let's go to what he posted and let's discuss. This patient actually posted his case on Facebook, and obviously he cited my name, and he's a male on his early 60s, and he has some symptoms, I believe, some fatigue and all that. So we did the testing, the testing that I usually do on my patient. And I just want to reiterate that this patient actually is unvaccinated. He got the infection in 2021, which was the early one. That's including still the wild type or probably the alpha, depending on what part of 2021 he was infected. And then he got reinfected, which is like a boost in 2025. So what he actually posted is this. He posted his T lymphocyte subset 2, which includes the CD3, CD4, CD8, and CD19. And this findings are actually very typical of COVID because I see this over and over and over again. It is the CD8 that's usually affected. I'm not saying that the CD3 and CD4 are not affected. These are, when I say CD, that's actually the population of T lymphocyte. Remember the CD4 is the T lymphocyte that's going down in the classic HIV AIDS. So in in COVID, whether it's infection or injection, you can actually develop immune deficiency involving your CD3, which is the entire population of T cell, and then you can also have the CD4 deficiency, which is not as common but can be affected. And then you have the CD8, which is as common as the CD3 and the CD8 and CD3 are the most common ones affected when you are talking about either infection or injection of the COVID um, vaccine. And so this is very typical. As you can see, the CD8 is low, and then the CD19 is also low. The CD19 is actually a B cell population, another immune cell, and the CD19 being B cells, they are the one responsible for producing the antibody. And so in his case, he also mentioned about having autoimmune, which is very true. When you have a dysfunction of the CD19 or the B cell, that's how you get into a heavy autoimmunity. That's the mechanism in terms of what cells or immune cells are affected. But um, uh, he tested positive for ANA, anti-nuclear antibody, which, by the way, is the most common autoimmune marker that is testing positive. And, to tell you honestly, this year, I have not seen anybody who's vaccinated or who got infected. So, infection, um, who did not or not tested positive for autoimmune. It's certain autoimmune. It's almost 100% of the patients testing positive for ANA as the most common auto antibody that is testing positive in all these cases. And depending on the what we call pattern of the ANA, it can become lupus, it can become mixed connective tissue disease, could be Sjogren's syndrome, it could be affecting the liver, which is an autoimmune hepatitis, affecting the thyroid, which is autoimmune thyroiditis. But there are other autoimmune markers that are testing positive after the ANA. And for the thyroid, you have the TPO, the thyroid peroxidase, and also the thyroglobulin. And so, depending on if it's the liver, you have the autoimmune um, markers or antibody that is called smooth muscle antibody. And so, depending on what's affected, then there's a very specific antibodies that are being produced or formed, being produced by the immune system. So that's very interesting. This patient developed immune deficiency involving the CD8, which are actually the killer cells. The CD8 is the one responsible for killing cancer cells when they are trying to form. And then the CD19, which basically is the population of B cell, another immune cell that can be activated to become plasma cell, and they can produce antibodies. So that's the interesting one. I hope you learned something from it, but that's the explanation. We'll do some more down the road. These are all included in my retrospective study. So, okay, thank you. That's the explanation. Bye.